My name is Danielle Schmidt. I'm an 8th semester nursing student. Today is August 27th, about 2:30 in the afternoon. Today I'll be performing how to do a central line dressing change. So I would go into my patient's room, I would perform hand hygiene, provide privacy, tell them my name is Danielle and I'll be your nurse today. Can you tell me your name and date of birth? And I would check their name and date of birth. I would explain to them that we are doing a central line dressing change. We usually do these on the 7th day, or if they're visibly soiled, then we would do them then. So I have my supplies. I have a central line dressing change tray, and then clean gloves, and I have a mask. To try to keep it as sterile as possible, we are going to put a mask on you, or you can turn their head to the left, so turn it away from the side. But we're just going to put a mask on. I'm going to perform hand hygiene. I'm going to put my clean gloves on. And when I go to take this off, I'm going to put my fingers on the skin to make sure that I'm not pulling. I could also use alcohol pad or adhesive remover, especially with older people who might have more frail skin. After I remove that, I'm going to take off my gloves and also just assess the site. If it looked like there were signs of infection, so redness, swelling, drainage, if it was like purulent drainage, I would just take a sample and send it to lab. Also just checking, I would measure the site of how much is sticking out, and then just assess. So now I'm going to change it. So I'm going to put these over here. Perform hand hygiene again. Open up my kit. Take this out. Open away. I have a mask for me. I have my sterile glove. I'm just going to set here. I'm going to throw that away. I'm going to open my kit. Only touching the outer inch. So after I've opened my kit, I'm going to put on my sterile gloves. Okay, once I have my sterile gloves, I'm going to grab the cleaning solution and I will click these to make the solution come out. And I'll rub vigorously up and down and side to side for about 30 seconds for 2 to 4 inches away from the insertion site. Throw that away. And I will let that dry. Do not blow on it. Do not hand wave. While that's drying, I'm going to get the new dressing out. After it is dried now, I'm going to place it back. Take the outer covering off. All while doing this, I would keep the patient updated on how the site looks, tell them that there were no signs of infections, just kind of keep them updated throughout the process. And then with this extra sticker, I would write my initials the date and time that I placed it, that I changed it. And after that, I would take my gloves off and tell the patient he or she could take their masks off. Take mine, I would clean up my area, and then I would go document how the patient tolerated it, the dressing change, if there are any signs of infection, or how the dressing looked, and that would be it. Thank you.